Is it up?
A surgical team, a robotic machine, and a skilled surgeon, Dr. John Boggess, who commands the robot and its precise movements from a console. It all comes together during a morning hysterectomy in the Rex OR.
All right, let's pull up the balloon.
I have a magnified view. I can see all the blood vessels. I can navigate around things that are typically difficult for me to see when I do traditional surgery. With a computer system in it, it eliminates tremor, for instance, so it actually smooths out the motion. And we have wristed instruments just like our wrists, but everything is miniaturized and magnified, and it's all introduced inside the patient's body through little tiny incisions. And what that does for patients is I can still do the same operation I would traditionally do, but now I can do it with less trauma to the patient. So they lose less blood on average by a significant margin. So that means fewer blood transfusions, less fatigue after surgery, so they're recovering more quickly. Their body's not putting resources into making up for that deficit. It's putting resources right into healing.
Josh, go ahead and switch that needle driver over and get me a stitch.
On average, by 2 weeks, most women that we treat are 80 to 90% back to normal. And that's in contrast to the old-fashioned way, where it's more 6 to 8 weeks with soreness that can last up to 6 months.
As a gynecologic oncologist, Dr. Boggess uses robotic surgery for women who suffer from uterine cancer, cancer of the womb, cervical cancer, or the cervix.
These are procedures that require lymph node dissection and more radical dissection, and traditionally require very long incisions and are associated with a lot of blood loss. And with the robot, we've eliminated blood loss essentially and eliminated those large incisions. So women are having recovery that looks like a simple hysterectomy even though they had a cancer operation.
With the robot, Dr. Boggess also performs complex hysterectomies for women with large fibroids or scar tissue or endometriosis.
With the robot, we're able to navigate around the important structures we don't want to damage, but still accomplish the hysterectomy with the small incisions and all the recovery benefits.